We know so many people were just so excited to hear just this little bit of information, but we also know you probably have a lot of questions about this. So this morning, Dr. Hawkinson from the University of Kansas Health System joins us live to look more into this CDC guidance. So doctor, the first thing I thought, the guidance says fully vaccinated people can safely be around a small household of other people who are not vaccinated, but they should really continue to follow all the other guidelines that we've been following, including not traveling, wearing the mask, not being in big groups. Can you explain what makes being a small group of unvaccinated people okay, but all of these other things we still need to do? What does the science say?
Yeah, I think it's just one household. And, again, I think we are just really trying to take conservative steps towards getting back to normalcy. And the first step is this small amount of population that is vaccinated. Hopefully this small amount will continue to increase and we can seek further guidance after this. They're really saying one household, and I think that is, again, to continue to keep bubbles small, to continue to reduce the chance of intermixing bubbles and spreading disease, and especially to those vulnerable people. Now, luckily, a lot of the nursing home residents and vulnerable people have been getting vaccinated. This will protect them greatly against hospitalization and death. But I think we are just kind of continuing to make conservative steps toward getting back to normalcy. And we have to understand that the variants are continuing to spread across the United States. And those are variants that we know of, and those are variants that we don't even know of yet, probably. But some of them can have increased risk of death. And so I think we fully don't know all the information about that. And I think these are just conservative initial steps towards getting back to being able to meet with other people and socialize and get back to some normalcy.
Doctor, another effect of these new guidelines from the CDC is quarantining. We've gotten very used to, oh, well, I have to be out for 2 weeks, not because of me, but because someone I work with, my kid has to miss this, that kind of thing. These new regulations say you don't have to quarantine after a known exposure if you're fully vaccinated, again, 2 weeks after your second shot, and as long as you have no symptoms. But we've talked about over the last year those asymptomatic COVID cases. So how is it still safe to skip a quarantine just because you don't have any symptoms?
Yeah, I was pretty surprised by seeing that. But we do know from some of the early real-world experience with, especially what Israel has published with their Pfizer experience, but also some of the initial trial data from the Johnson & Johnson vaccine, where it actually did show a reduced amount of asymptomatic infection, meaning people that had the infection but had no symptoms. We know that a lot of spread of the disease is because people don't even know they have it and don't have symptoms, so they're spreading it. But what we saw in those published reports and that early data is that there was actually a significant reduction of those types of cases from people who were vaccinated, again, with Johnson & Johnson and that real-world Pfizer experience. So then from that, we can extrapolate saying, well, if we have less asymptomatic disease, because we already know we have less total disease, then we would presumably think that we have less ability to spread the infection as well. So we have a little bit of signal and data to support that as well. But I was pretty surprised by that. I think it's some good guidance, and we'll continue to evaluate, and hopefully we will be able to continue that type of thing, because I know it's hard for people to miss work. Everybody wants to be working. Missing work days has been a huge issue during this pandemic, and this is one thing maybe to protect against that.
Well, doctor, I know as soon as I heard that news yesterday, after next week, all of my grandparents will have their second shot, and they have been waiting a long time just to hug my toddler. You're fully vaccinated, so we wanted to ask if this guidance, you with all the knowledge you have as a doctor, will change the way that you behave, or are you still sticking to what you've been doing this whole time?
Yeah, I mean, I will still be, if, for instance, going to the gym, I'm still going to be wearing my mask. I wore my mask today. But, can I meet with one or two other people that are vaccinated? Absolutely. I'll go by the guidance as I have. I think most importantly, though, is, I've only been able to see my parents once through this whole pandemic, so more than a year or so. But hopefully, within the next couple months, I'll be able to drive up there and see them, see my grandmother who is in a nursing facility, and she got vaccinated, I think even before I did. So being able to see, our loved ones and my parents and that will be good. And I hope that that's going to be the case for a lot of people and a lot of families, being able to see people that they haven't been able to and spend time and quality time with those loved ones.
I know I was not prepared for how emotional it made me, just the thought of knowing that very soon I could hug them and not be afraid.
Yeah.
Oh, goodness, it's been a long time. All right, doctor, thank you very much.